Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Sign symptoms and uses of Homeo-Remedy Silicea. Before I start, I just want to give some information to my respected viewers that this particular video is too long as 40 minutes or more. I could not help it because if I had to do it, then I had to divide it, but I don't want to divide any particular topics. To start with, I have loaded a few video with part 1, part 2, etc. this type. I think this is very wrong system because the viewers want to keep a thing compact together. So I warn you, please have your time. This is possibly the longest video of all. Total time more than 40 minutes. Full name Silicea, common name pure silica, source chemical compound, chemical kingdom, therapeutic of Silicea, bone affection, gastrointestinal affection, cancer, skin affections, fistula, affection of eyes, affection of male, female genital organs, headache, toothache, urinary symptoms, affections of glands, respiratory affection, etc. Spheres of action of Silicea. It acts upon bone, cartilages, mucous membrane, skin, elastic, cellular tissue, nerve, gland, ducts, uretration tube, etc. etc. Constitution. Look, lean, thin, lacking physical grit. Temperament, nervous, irritable, sanguine temperament. Diathesis of Silicea, scrofulous. Hot or chilly? Chilly. Mental genital of Silicea. Applied of pointed things like pins, needles, nails, screws, etc. Spigelia is in Spigelia we get this symptom also. Fears those, count those, and collect those. Okay, this is called belanophobia. Adults are yielding, faint-hearted, sullen, with sensitive weeping mood. Children are obstinate, headstrong, cry when spoken kindly to. Mental acuteness with physical weakness and torpidity. Torpidity actually sluggish in action. Compunction or conscience about trifles, matter of little value. Loss of self-confidence, dates, failure. But assignment once taken up, finished successfully. Brain fag, cannot express him correctly, fidgety. Complains a lot about imaginary things, indifference to religion. Mental labor, very difficult. Reading, writing, fatigue easily. Reading, writing, fatigue easily. Look at this little girl. He is completely in fatigue condition after reading a few minutes. Cannot bear to think. Hopeless, sad, disgust for life. Hopeless, sad, disgust for life. Wish to drown self to death. There is some sort of committing suicide. Screaming violently, groaning, epilepsy. Sensation of a hair on tongue, in throat. This is you call an USP. USP means uncommon, strange, peculiar symptom. One uncommon, peculiar, strange symptom, one particular USP may indicate a particular medicine. If you get this medicine strongly in a patient, you need not consult other things. You straight go to Silicea 200. Straight go to Silicea 200 and wait for 1 month, or maybe it may act more than 2 months, and the sensation will go off along with other troubles. Physical journals of Silicea acts like nature's surgeon, can easily reach every nook and corner of the body to expel foreign body out in a non-invasive way. Invasive way means application of knives, scissors, needles, etc. But Silicea acts very nicely. This is non-invasive way. It can go to lung, liver, skin, anywhere in the body, and it will expel the foreign body out from there, causing suppuration, and with the pus it will be expelled out. It has been experienced lakhs of times, maybe millions of times, that this medicine, when given in low potency, say 3x, causes suppuration around that foreign body in the inner body. Foreign body means something else that not related to our body. In our body, it will cause pus. The particular place will swollen up. There will be pus, and it will burst out. And with that pus and blood, that foreign thing will be out of the body. That is a beautiful action of Silicea, and it is acknowledged by every man in the world. Maybe he an allopathic good surgeon. He also, if he knows, he also appreciates, yes, this is very good. But there is a few warning here. In case of lung, in many persons' lung, there are sealed fibroids. Actually, within the fibroids, the tubercular bacteria are trapped, and around them some fibrous tissue, so that it is locked within the body, but it cannot spread. That is, a man has got some tubercular infection, but that infection was trapped by body within the body. In such a person, if Silicea is given, the tubercular germs may come out. So before giving Silicea, please ascertain that such thing is not there in the lung of the person. Because in that case, something trouble may arise if you go give Silicea in low potency repeatedly. Very much adapted to person with deficient nutrition, not because food is lacking in quality or in quantity, but from imperfect assimilation of food. This has been taken from keynotes of leading remedies, DR.H.C.Allen's book. Now, I have got something to share on this. Food lacking quality, quantity, and imperfect assimilation. But there are 2 or 3 steps between this lack in quality and quantity and assimilation. You take good quality of food in good quantity. Then the food is to be digested properly by the enzymes in your intestine. After digestion, it will be absorbed in the lacteals. It will be absorbed in the lacteals of small intestine mainly. Then it will go in the blood, finally in the liver, and it will be assimilated. So there are so many steps within. How can one say that if one take good quality of food, good quantity, and assimilation, only in imperfect assimilation he is not getting enough nutrition? So there may be other things also. Oversensitive and want of grit, physically, mentally. Children scrofulous, rachitic with large head, open fontanelles and sutures, much sweating around the head, less than calcaria, which must be kept warm by covering, distended abdomen, weak ankles, slow in milestone development. Patients are cachectic, debilitated, exhausted with erethism from hard work or close confinement, want to lie down always, want of vital heat, always chilly even during taking active exercise. Inflammation, swelling and suppuration of glands like cervical, neck, axillary, mammary, inguinal, sebaceous, and that gland may go gangrenous and even malignant. This is the picture of one picture of a baby with open fontanelle. Look, mind this is called fontanelle. It remains open for long time in case of this type of patient, and the sutures. There are so many sutures in our skull. One suture is there. The suture also remains open because this patient suffers from malnutrition by birth. So their bone development is also in trouble. So this remains open and sutures are not properly joined. This is also swollen lymph node, a picture of swollen lymph node. There are so many lymph nodes in neck. Ordinarily, these are not palpable or seen, but in case of Silicea patient, these are swollen, large, sometimes maybe suppuration. Physical general Silicea continuing.
Cicatrices, indurated, hard, nodular, shiny, glassy, tender with shooting pains, keloids, dropsy, cancer, contracted sphincter, cerebral softening. Ill effects of suppressed food sweat. These things also cuprum, graphitis surinam, exposing head or back to slight draft of air. That is from all this, some trouble starts. That is called ill effects. And to antagonize this ill effect, Silicea is the medicine. Vaccination, especially abscesses or convulsion. After vaccination, this convulsion abscesses occurs. Chest complaint of stone cutters with complete loss of strength. Stone cutter used to suffer from a disease called silicosis. That silicosis disease can be cured by this Silicea. If the doctor happens to know the fact that Silicea is a good friend of this stone cutters for this type of disease. Convulsion, epilepsy, aura starts from solar plexus. Person who is going to be attacked with epilepsy or convulsion, few seconds before he feels an uncanny sensation in his body, somewhere in body. In case of this, in some cases this is felt in the solar plexus. Now, what is solar plexus? Solar plexus, here it is. Solar plexus is a collection of two bundles of nerves or ganglion that intervene and pass each other at a central location, abdomen. This picture actually behind the abdomen, this is the spinal column. On the spinal column, this solar plexus is lying. This is collection of bundles of nerves. This is called solar plexus. This is very important nerves. This is called also chakra. From this aura comes in case of epilepsy convulsion. Then Silicea will be the medicine. Skin unhealthy. Every injury suppurates. All discharge from body like stool, urine, sweat, pus, leukorrhea, and menses are offensive. Sweat of hands, toes, axilla, all very offensive. Constipation before, during, after menses. Somnambulism. Somnambulism, night walking. Such type patients get up from the bed in sleeping condition, moves around, then again goes to bed and sleeps. Whole thing occurs during sleeping condition, but the patient doesn't know anything. Now, this is the cicatrice. See, this is a cicatrice. Cicatrice is actually scar that shows the healing of some wounds. That wounds may be something injury wounds, or something maybe it may be wounds of operative surgery. And there are Leben's scar, that is called cicatrice. This cicatrice sometimes festers, that is some sort of fluid comes out, it swells up, there is pain, there is stitching pain, the place becomes hot. These problems of cicatrice and keloid. Keloid is another type of same thing, some healing effect, but here the accumulated thing is in protein in nature. This is called collagen. Collagen fiber accumulates, and these are much more thicker and broader than cicatrice. In both the case, the troubles appears. This may be, there may be some infection, there may be some festering, coming out of pulse, swelling, pain, stitching pain, whatever cicatrice is, the same may be in keloid. In all these two type of disease, Silicea is the medicine. Just Silicea 200, 2 doses will suffice. Within 15 days, it will be completely healed up. General aggravation and amelioration of Silicea: worse from cold, air, draft, damp, uncovering, bathing, checked sweat of feet, nervous excitement, light, noise, jarring of spine, night, mental or physical exertion, alcohol, touch, pressure, change of weather, combing hair. Better from warm wrap of head. This is a very important symptom. Warm wrap of head, Silicea patient is always feel nice. Summer, wet, humid weather, profuse urination, magnetism and electricity. That is, effects of magnetism and electricity on such persons is very soothing. Head symptoms of Silicea: chronic sick headache, seen some severe illness of youth. Suriname also come come into play here. Ascending from nape of the neck to the vertex. Ascending from the nape of the neck. This is the picture. This is the nape of the neck. From here the pain starts and goes up to the level of vertex. As if coming from the spine and locating in one eye, especially right, or sometimes this goes above the skull and settle in the right eye. This is not right eye, this is left eye. On the other hand, there is a right eye. On that particular eye, sometimes the pain settles. Headache from this pain, if it is on the left eye, it will be spigillia. Left spigillia means such thing happens if on the left side, then spigillia of the medicine. Headache from study, exertion, noise, motion, jar, light, talking, straining at stool, fasting, not eating timely. So many causes are there for headache. Worse from draft of air, uncovering the head. Better from pressure, wrapping up head warmly. That particular symptom. Better from profuse urination. Migraine, that is pain in the part portion, half, left half or right half, or eye, particular portion of head. Premature baldness. Infantile cephalohematoma. This is cephalohematoma. Infantile cephalohematoma. This occurs due to birth injury. Actually, blood accumulates between the layer of bone, that is skull, and the covering of the bone, that is periosteum. Between periosteum and actual bone, this blood is accumulated. This is called cephalohematoma. It's caused by birth injury. This is nicely, beautifully absorbed by silicea. One dose of silicea. If the baby is not in a position to take medicine, the mother will take the medicine, and through mother's milk, the baby will get the benefit of it automatically. This is very nice. If you see, you can't, unless you see, you can't believe these things. We have seen with our own eyes how beautiful this medicine acts through mother's milk. Vertigo of spinal origin, ascending from back of neck to vertex. The same thing, vertigo. Same thing, ascending from the neck to vertex. This is the vertex area. From looking up, vertigo from looking up. Pulsatilla also from looking up, but looking down, calmia and pulsatilla. Both the things, looking down. Moist, crusty eruptions on scalp. Eye symptoms of silicea. Inflammation of eyes, hypopian. Hypopian means accumulation of water within, actually, between the layer. The outer layer is cornea, inner is the lens. Within the space, accumulation of water. Hypopian. Opacity of cornea. After smallpox, that is after smallpox, this type of disease, hypopian, opacity, cornea, use 30 a dose daily in morning for months. This has been collected from a very, very top pioneer of ancient times, because this type of medicine are not presently used. There was a time when this homeopathy was all over the world, and particularly in America, it was extensively practiced. And most of the stalwarts of homeopathic actually are from America. But to be frank, now there is little practice in homeopathy in America. Cataract in office worker after suppressed food. Styes and encysted tumor of eyelids to prevent their recurrence. Affection of canthi. Canthi means corner of the eye. This corner, these are called canthi. Canthi of the eye, tear duct, lacrimal ducts, fistula, swelling, stricture. You will be astonished to know that this silicea, how nicely it acts on lacrimal duct fistula or lacrimal duct stricture. If you diagnose a particular disease and use silicea, then in this case hypothesis is required, say 200, 1 or 2 dose, it will suffice. Glands, pustular or perforating keratitis. Keratitis means inflammation of the cornea. That inflammation of the cornea, that may be pustulate eruption, that may be perforating, there may be perforation on the cornea itself. It will also be tackled by Silicea. Spotted vision. Objects appear pale. Aversion to daylight. It dazzles. That is, the daylight dazzles. Later run together while reading. Ear symptom of Silicea. Roaring and hissing in ears. Perforated drum. This is perforation of drums. This is perforation of drums. Eardrum. Perforation of drums. Caries of mastoid process. Behind the ear, there is a bone. We can feel it. If we go place your hand behind your ear, you will see some soil hard spot. That is called mastoid process. Very often that particular portion goes into Carey state. First inflammation, then caries. This Silicea will take up that case. Deafness, but hears again with a loud report or on blowing the nose or coughing. Worse on full moon. Feeling of stoppage of air better by yawning or swallowing. Fetid discharge from the ear. This is fetid discharge from the ear. Ear sensitive noise. Crusty formation in ears. Crusty formation in the ears. This is some crust formation in the ears. This is some crust formation in the ears. Child bores into ears when asleep. That is, child uses his or her finger in the ear. That is boring, but some trouble is there. So he is doing this. This symptom will suffice to give him a dose of 30 potency, and it will go off. This image I have not explained. This is keratitis. This is healthy eye, and this is keratitis. There is an inflammation of the cornea. Inflammation of the cornea is always together with the inflammation of this is called conjunctivitis. And this is normal drum. This is perforated drum. This is normal ear. This is ear with mastoid process in trouble. No symptom of Silicea. Frothy nasal discharge. Perforation of septum, bone sore. Epistaxis with coryza. Hard, dry crusts. Bleeding when loosened. Sneezing in the morning. Obstinate cold with ear affection. Face symptom of Silicea. Face pale, cachectic, waxy. Enlarged parotids. Cracks in lips on the skin of face. Indurated fissure on corner of the lips. Swollen maxillary glands. Cancer of lower lips. This is cancer of lower lips. This is boil on the gum. And this is we have not come to that. Let us read further. Mouth symptom of Silicea, abscess at the root of teeth. That is within the root of the teeth, abscess. You cannot see that because this is an inner thing. But pain will sometimes occur. Sometimes fistula will start. Because when there is abscess, there will be accumulation of pus. The pus will come out, so the body will create a channel, and that channel will be opened in the gum area. That is fistula. In that fistula is a result of the abscess, and this is gum. Since it is external, you can see it. Within the root, you cannot see, but both the things are covered by Silicea. So, we are here. Abscess and root of the teeth, boils in the gum, pyorrhea. Water tastes badly, vomits after drinking. Sensation as if a hair stuck in the tongue. This is a very, very peculiar symptom of Silicea. I have already read it. Sensation of hair stuck on tongue. Teeth break down, lose enamels, turn brown, rough, caries. Teeth feel too large or too long for mouth. One side swelling of tongue. This is one side of swelling. One side swelling of tongue. This type of symptom very often puzzle the physicians unless you know that this particular symptom for Silicea. Third symptom Silicea, tonsils swollen, suppurating, food ejected through nose from swallowing, pricking pain as of a pin in tonsils, hawk's foul lumps, swallowing painful. This is suppurating tonsils. Since tonsils are so much inflamed, food comes from mouth and doesn't go inside the esophagus. Rather, it goes up and comes out from the nasal opening. Stomach symptoms of silicea: aversion to cooked warm food, especially meat. Mother's milk to babies. That is mother's milk. The babies has got aversion to mother's milk. Likes ice cream, ice water, feels comfortable when it is in stomach. Water taste is bad, vomits out after drinking. Voracious appetite, which disappears on attempting to eat, or loathing of food. That is, the one is voracious appetite may be there, or completely loathing of food. Sour eructation, vomiting after eating, gnawing and twisting pain in epigastrium. Epigastrium is the region just beneath our sternum, a dagger bone. Worse from pressure, as if a cold stone were there in stomach. Respiratory symptoms, silicea: gagging, shaking, retching, cough. Worse from cold drinks, talking, lying after walking. Chronic cold settle in chest, brought about asthmatic attack after overheated or exertions. Psychotic asthma. This psychotic means psychosis. For our psychotic means the psychosis miasmatic state. Asthma occurring from that psychosis. Profuse, foul, yellow, lumpy, offensive sputum. Cold does not yield. Slow recovery from pneumonia. Stitches in the chest through back. Shortness of breath from manual labor. Emphysema after pleurisy. This is the picture of pleurisy. Pleurisy actually accumulation of fluid within the pleural space. There are two layers of pleura over the lung. One is parietal pleura and other is visceral pleura. This accumulation of fluid is called pleurisy. This is a very painful disease. The patient cannot breathe. If he wants to breathe, he will feel sharp stitching pain in the chest and he will automatically stop breathing. He manually stop breathing voluntarily because so painful, and then very slowly he will try to get respiration. So this is pleurisy. Actually, tubercular infection is one of the most common cause, and from the same cause, another disease may come, that is emphysema. In emphysema, the alveolar sacs are completely damaged. Alveolar sacs are damaged, and the elasticity of the alveolar sacs is lost. So lung remain always inflated. There is no inflation and dip. Swelling in or contracting out. This is not done. Lung is in healthy lung. The lung is inflated then deflated. Inflated then deflated. That is some elasticity is acting within the lung. That elasticity comes from this alveolar sacs. But when these alveolar sacs are damaged, the lung is completely in a state of inflated. The patient cannot exhale out air, and that's why he's suffering from dyspnea. With this, this video ends. Thanks for listening and viewing. If there are any questions, please write down in this comment section. I will certainly answer.
Abdomen symptoms of silicea: throbbing pain in the area of liver, abscess of liver, colic, cutting pain with yellow hands and face and blue nails, cramping pain in rectum extending to testis, worse from coition. In children, distended, hard, hot abdomen with thin legs. Now look at this picture of the child. Constipation, worse before and during menses, staining with even soft stool with exhaustion, moist anus, foul flatus, stool comes out with difficulty. When partly expelled, recedes again. That is, stool comes out partly, then again go back due to pain in the anal region. Retained for fear of pain. For fear of pain, the stool remains. Fissure, fistula in ano, with chest symptoms, painful spasms of anal sphincter, intensely painful piles protrude during stool. Sphincter, you mean anal sphincter. Sphincter means muscles that acts like some valve. anal, we can control it. We can control it. Sphincter muscles are under voluntary control, generally under voluntary control. We can compress it, we can relax it, we can constrict it, we can relax it. Foul chronic chronic diarrhea, stool painless, lyenteric. Lyenteric means the stool containing the food particles. Worse after milk, tapeworm, hernial tumor tender, ascites with great effusion, with frequent attacks of diarrhea. Now look at this figure. This is fissure. Fissure means cracking, crack, just a crack at the end of the anal canal. Piles are just distended veins, and sometimes the veins ruptures, bleeds. It's painful. Fistula is actually some sort of boils like thing within the content of within the muscle tissue of the anus or rectum, and wherefrom this boil burst and the pus, blood, etc. comes out through passage. This passage is created by the system, and through this passage the blood, pus just comes out. This is fistula. The three different type of is fissure, piles, fistula, or near anal canal or rectum, but three are different type. These are mainly crack, very painful. This is bleeds, painful, of course painful, also bleeding. Fistula, the same thing, but in the fistula and in piles there are oozing, extensive oozing of blood, pus, etc. from the anus. But in case of fissure there is no oozing generally. But pain is in fissure much more, because there is only dry crack.
Urinary symptoms of silicea. Frequent urination with tenesmus in children, nocturnal enuresis from worms, chronic urethritis, foul discharge from urethra, thick, curdy, purulent, bloody, pus in urine, nightly incontinence after a blow on the head, that is from injury. Renal and vesical calculi. Calculi means stones, that is kidney stone, and stone of vesicle means bladder, urinary bladder. Male symptoms silicea, foul gonorrheal urethral discharge. Note this, gonorrheal, that is clap, gonorrhea, clap. After coition, sensation of right side of head as if paralyzed. It is written as USP. You know, the modern term USP is actually unique selling point. Unique selling point, but here it is not unique selling point. It means uncommon, strange, peculiar symptom. Uncommon, strange, peculiar symptoms in homeopathy is of highest importance, because this symptom, a single symptoms, can point to particular medicine. If any patient says that, sir, after I committed some sexual relationship, my right side of the head, I think that it is paralyzed. So this is the uncommon, strange, peculiar symptom. For particular this symptom, you can go directly to silicea without listening to others. It is such an important symptom. Of course, if there is a massive pathological symptom somewhere else, that can be taken up earlier, but otherwise a single uncommon, strange, peculiar symptom can point to a disease or to a particular medicine. Itching moist spots on scrotum, hydrocele. Sexual appetite may increase or decrease. Prostaturia, what's straining at stool. Hydrocele, accumulation of water in the testicles. Elephantiasis or filariasis of scrotum. On the right hand side, this small image has been given. This is a boy of say 10 years old. Filariasis is actually a parasitical disease. Parasites, Ucheraria bancrofti, actually causes this type of disease, and this affects skin, lymphatic tissue, mucous membrane. Extreme exhaustion after coition takes 10 to 8 days to come to normalcy. That is, after a single coition, patient takes 8 to 10 days to come to normal health, normal strength. Painful eruption on mons veneris. Mons veneris means mons peevish of the women. That is just lying on the a flat and slightly mound area just above the external genitalia. This is called mons veneris. They are painful eruptions. Now, this image of these images, this image I have already told, this is Ucheriria bronchiectasis, the parasites which causes this elephantiasis. Elephantiasis phylaris of scrotum is written, but mind it, elephantiasis may happen in leg, in arms also. This is leg elephantiasis. This is scrotum. All elephantiasis are covered by Silicea. Since it is male sexual symptom, so this is only given scrotum. But later on, when we will be describing skin, you will see that elephantiasis of all form can be taken up by Silicea. And this is a boy of class, just boy of class, not I mean, age 10 years old just. So his scrotum is like this. This is elephantiasis. Not too much troublesome, but it is physically troublesome. There is not much pain. It is a more or less painless disease. But infection, repeated infection comes from this infection. This infection brought other infection, and for that reason, the patient used to suffer from fever very often.
Female symptoms of Silicea: increased menses, menorrhagia, with paroxysm of icy coldness over body, cutting upward in vagina worse during urinating, leukorrhea milky, acrid, gassy, worse during urinating, itching of vulva and vagina. Bloody discharge from vagina every time child nurses breast. This is an exceptional symptoms. We call it USP, uncommon, strange, peculiar. Uncommon, strange, peculiar symptom. A single symptom can guide us to a particular medicine. If this symptom is there, we can directly give Silicea. Bloody discharge between periods, nipple sore and retracted like a funnel, hard lump, fistula in mammary, serous cyst, fistula's opening and abscess about vulva. Vulva means external genitalia. Vagina is the internal genitalia. Abscess in mammary. Sciras with itching. Sciras is a type of cancer, generally seen in mammary. Sharp pain in uterus and breast. Menses early scanty. Amenorrhea for months. Uterine discharge instead of menses. Fistular opening in or around vagina with thick cardy discharge. Salpingitis with pus and serum which escapes from vagina via uterus time to time. Salpingitis is inflammation of fallopian tubes, shown on the right side, on the right hand side. Natural abortion from weakness, or they do not conceive for weakness, not at all conceive for weakness. So Silicea is a great medicine here. The person who generally do not conceive due to weakness, so Silicea correct that weakness and the lady goes into conception. Nausea during coition. See, nausea during coition is an USP, uncommon, strange, peculiar symptom. Sterility and nymphomania. Heart symptoms of Silicea: throbbing all over the body when sitting or in motion, palpitation while sitting with trembling of hand, heart trouble arising from nervous exertion. Mind it, heart trouble arising from nervous exertion, not other things. Heart trouble arises from different, so many causes are there. So nervous cause, heart trouble, Silicea. Neck and back symptoms of Silicea: spine weak, very sensitive to draft of back, backache as from riding in carriage for a long time, burning in back when body is being heated after walking in open air, stiff neck with headache. Painful kyphosis, picture 1. Painful kyphosis. Kyphosis is this curvature, normal curvature is severely increased backwards, the kyphosis. Lameness in region of sacrum. This is the sacrum region. It is seen from the front side, back side can be seen also. This is sacrum region. Painful coccyx. This is the coccyx region. Psoas abscess. Psoas muscle is within the pelvic region actually. Within that psoas muscle, some iliopsoas abscess is formed, and that is a very painful and rare type of disease. There Silicea show wonder. Caries of vertebra. Vertebra means this thing. This is part of the vertebra. This is vertebra. This is vertebra. So sometimes this vertebra gets caries, that is degenerated. It can be stopped by using a silicea. Spina bifida. Spina bifida is a actually congenital deformity of spinal cord. See the spinal cord. This spinal cord has come out of this hard structure. Within this gap, within this vertebra, this is vertebra. Within this vertebra, there is a gap. This filled up by some cartilage-like things. Through that area, this portion of the internal nervous structure, that is spinal cord, has comes out. This is also taken up by silicea nicely. You seldom believe that these peculiar difficulties are cured by homeopathic medicine unless you see with your own eye. But it is so. It is so. Extremity symptoms of silicea. Calves tense and contracted. Cramps in calves and soles. Sore ache in arch of feet. Rheumatism, especially of soles, cannot walk. Voluptuous tingling in soles. Note the symptom. Voluptuous tingling in soles. This is a USP. Uncommon, strange, peculiar symptom. Please remember this. Voluptuous tingling in soles, silicea. Cramps in knees, enlarged bursa over patella. Legs feel paralyzed, trembling when walking. Weak ankles and feet. Icy cold and sweaty feet. Foot sweats foul, itching, acrid, damaging shoes. Sweat, damaging shoes. Nails rough, yellow, crippled, brittle, white spot, blue. In the picture on the right hand side of the nails, that blueness or rather white spots are not here, but it is others has been demonstrated here. Yellow, distorted, ingrown nails, deep-seated pain in phalanx, atrophy and numbness of fingers, soft corn between toes, soft corn in toes. This is the soft corn in toes. Ulcer around joints with bloody purulent discharge. Axillary glands swollen, enlarged. Bruised feeling all over body after coagulation or emission. Another USP. Bruised feeling all over body after coagulation or emission, not after say beating up or after a fall or after an injury, no. After coagulation, emission, bruised feeling. So this is an USP. Uncommon, strange, peculiar symptom. Forearms lame, trembling of hands when attempting to do something. Left arm sex before epilepsy. This is an aura. Aura means something, some premonitory symptoms that is shown before the attack of epilepsy. So this aura, left arm shaking aura, is peculiar to silicea. Pain lain on, parts lain on, go to sleep. Parts lain on, go to sleep. Bunions and periostitis. Bunion, you know, some sort of corns. Periostitis is periosteum, inflammation of periosteum, that is bone. Skin symptoms of silicea. Lifeless, clammy skin. Every little injury separate. Acuminate eruptions. Scar suddenly goes painful. Scar, old scar suddenly goes painful. Keloid. Keloid means inflammation of say some skin which has been repaired by say secondary or tertiary intentions. That keloid. Leprous node. This is leprous node. Coppery spots, carbuncle, ulcer, painfully sensitive, spongy, foul on feet, toes, nails, better from warm covering. Heat, abscess on joints, eruptions each during daytime and evening only. Eruptions each during daytime and evening only. USP. Eruption each only during this time. Sensation of coldness in ulcers. Another USP. Ulcers are not generally cold, but here cold sensation in the ulcers. Warty growth, rose-colored blotches, elephantiasis. This is elephantiasis. Face symptoms silicea, hectic fever, chilly, worse lying bed, exertion, coldness of painful parts, icy chill, sweat profuse on upper part of the body, head, affected part at night, foul acrid as soon as he falls asleep. That is, foul acrid means the sweat foul acrid as soon as he falls asleep. Complementary medicine, furic acid, phosphorus, thuja. Related medicine, calcareous carb, hypersalp, califos. With this, the video ends. Thanks for listening and viewing. Got anything to say? Please write it in the comment section. I would certainly respond. Possibly this is the biggest video ever